testing a new pill to treat postpartum depression in new moms. Here to talk about that is Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center. And we've been told that we can call you Dr. Alice, yes?
Hey, Dr. Alice.
Yeah.
Okay, he's already got it, so there we go.
All right, but okay, Dr. Alice, I'm going to need help pronouncing this, right? So the medication is called zuranolone?
That's right, yes.
Okay, so how is that different from other drugs that are already available?
Yeah, so zuranolone varies from traditional antidepressants in two big ways. The first is that many participants in this FDA trial noticed immediate effects. In more traditional antidepressants, improvement can often take several weeks, sometimes even up to 6 weeks. And two, this is a short-term treatment that provides long-lasting effects. So most mental health medication is taken indefinitely and results don't last after someone discontinues the medication. In this trial, participants took the pill for only 14 days and continued to see improvement in mood, cognitive functioning, and anxiety for 30 days and even 45 days after beginning treatment.
Maybe 3 times as long. All right. Yeah.
Interesting. So researchers, doctor, they've been testing different doses of this, and this is all part of a stage 3 trial. So what does the new data show?
Yeah, so this data shows that not only is the medication safe and effective, it's also well tolerated by most people, meaning that the side effects are minimal, even at higher doses. So improvements in symptoms can be faster, more significant, and longer lasting without sacrificing comfort and functioning.
So the FDA is expected to make a decision apparently within the next 10 days. It's a relatively short period of time. But in the meantime, what do you want new moms to know about getting help if they are struggling?
Yeah, having a baby can be overwhelming. There are these major hormonal changes that happen, there's sleep deprivation, and it's a huge life transition. So it's really normal for people to feel some changes in mood, especially in the first 10 days. However, if you're continuing to feel really overwhelmed, weepy, or anxious for more than 2 weeks after delivery, or if you're having thoughts of wanting to hurt yourself or your baby, please reach out to your doctor. They may recommend medication or connect you with a therapist or support group. In addition, don't be afraid to lean on your spouse, family, friends, maybe a doula or a night nurse for support. Whether it's sharing your feelings or asking someone to just drop off a meal or, look after the other kids you have. No one expects you to do this alone.
And not alone, and I don't know if this is the right word to use, but it's normal to feel like that. I mean, or maybe it's abnormal, but it's okay if you feel like that, and make sure you reach out.
You're not the only
for help.
one.
Exactly, right, doctor?
Exactly.
All right.
Yes, exactly. It's okay to not be okay. Just reach out for help.
That's what I was trying to say. Perfect. That's why you're the doctor, and we're news anchors over here. Dr. Connors-Kellgren, Dr. Alice, thank you so much. Stay well.
Thanks, Dr.
We appreciate
Alice.
it.
Great to see you.